Assalamu alaikum wa rahmatullahi wa barakatuh, students. Here we go. Unit 12, Part B. Unit 12, Part B. Let's have a look. Starting here. Last class, we finished the listening. We checked that together and we stopped here for the snapshot. Holds or common remedies. And if you look, there are some pictures here. Let's look at the pictures first. These are the remedies that we use for colds and sickness. The medicine, different medicines that we use. All right. So let's listen. Bismillah.
Page 80, Exercise 5, Snapshot. Listen and practice. Common remedies.
Chamomile tea, cough syrup, chicken soup, cold medicine, eye drops, aspirin, antacid, nasal spray, ice pack.
Some of these we have here: chamomile tea, very famous; cough syrup, of course; chicken soup; cold medicine; eye drops; aspirin; antacid for your stomach, stop the acid; nasal spray. Nasal is your nose, so the spray for your nose; and ice pack, this bag that we use for ice. Here on the bottom it says, what medications or home remedies do you use when you're sick? What medications or home remedies do you use when you're sick? And what remedies are good in your opinion? And what remedies aren't good? So we will discuss this together in class or online, wherever we meet. But be ready to answer these questions here down below, please. So, like I said before, that snapshot is the introduction to the next section. So here we have a picture. Where is this, do you think? Where is this? To me, it looks like a train, but I don't think this woman would be on a train looking like that, right? Here. So she looks like a doctor. So this must be her patient. There's a computer. So we want to know, Dr. Yun is treating Miss Lake. We want to know, how does Miss Lake feel? Please listen to the audio.
Page 81, Exercise 6, Conversation. Try to relax. Listen and practice.
Hello, Ms. Lake. How are you today?
Not so good.
What's wrong exactly?
I'm exhausted.
Why are you so tired?
I don't know. I just can't sleep at night.
Okay, let's take a look at you.
A few minutes later,
I'm going to give you some pills. Take one pill every evening after dinner.
Okay.
And don't drink coffee, tea, or soda.
Anything else?
Yes, try to relax.
All right. Thanks, Dr. Yun.
Oh, Dr. Yun is nice. Dr. Yun is nice. And what is wrong with Miss Lake? Did you hear it? Did you hear what's wrong with her? If you didn't, you can listen again. If you did, then we will check your answer. Miss Lake says that she is exhausted. Exhausted. She's very, very tired. Exhausted. Extremely tired. And she says that she can't sleep at night. She's extremely tired and she can't sleep at night. All right. So this is a conversation in the doctor's office. So please practice. And remember, it's conversation, not reading. You should be looking at your partner, looking at the computer, looking at the wall. I don't care. Don't read from the book. All right? Practice, practice, practice. Practice, practice, practice. And we will also practice this together in class. So make sure you get enough practice at home to help you. All right? And we will move on now to the next exercise, listening. I think I have a cold. I think I have a cold. So our friend, Dr. Yun, is talking to four other patients: Roberto, Courtney, Ryan, and Samantha. It says, what does she give them? What does she give them? Check the correct medication. Check the correct medication for each one. La.
Page 81. Exercise 7. Listening. I think I have a cold. Listen to Dr. Yoon talk to 4 other patients. What does she give them? Check the correct medications. 1.
What's the matter, Roberto?
I think I have a cold. I feel awful. I have a sore throat and a headache.
Okay, let's take a look. Yes, you have a cold. I'll give you some cold medicine. Take 1 pill every 4 hours. Do you have a cough, too?
Yeah.
All right, I'll give you some cough syrup, too. I hope it helps.
2.
What can I do for you, Courtney?
I have really itchy eyes. And, well, it's my nose.
Is it difficult to breathe?
A little. I think it's my allergies.
I see. Well, try these eye drops. And I'm going to give you some nasal spray.
Thank you.
3.
How are you feeling today, Ryan?
Not so great. I have a really bad earache.
Let's take a look. I'm going to give you some aspirin.
Okay. Anything else?
Yes, don't go swimming for a week.
4.
How do you feel today, Samantha?
A little better, but I have a sore knee. It really hurts, actually.
Let me see. Yes. Well, I'm going to give you some ice packs. Put 1 on your knee every evening for a few hours.
Okay. Thank you, doctor.
Page 81.
All right, students, hopefully you did the work. We're going to look at your answers for the listening exercise. They look like this. So Roberto, he took cough syrup and cold medicine. Cough syrup and cold medicine. And Courtney, she took eye drops and nasal spray. Eye drops, nasal spray. And Ryan took aspirin, and Samantha took ice packs. Ice packs. All right. Those should be your answers. Feel free to listen again. You do have the audio, or you can record the video. Let's look at the pronunciation. Practice the intonation in these sentences. Please notice that they all go down. They all go down.
Exercise 8. Pronunciation. Sentence intonation. Part A. Listen and practice. Notice the intonation in these sentences.
Take these pills.
Don't take cough syrup.
Drink some tea.
Don't drink coffee.
Try to relax.
Don't work too hard.
All right, easy peasy, but you need to practice. Easy peasy, but you need to practice. The intonation, all of them are falling intonation. So feel free to listen again and to practice so that your intonation goes down. All right. And then it says practice the conversation. Part B, practice the conversation in exercise 6. Again, pay attention to the sentence intonation. Pay attention to the sentence intonation. All right. So enjoy, students. Enjoy. Like I said, Unit 12 is kind of easy. Here's the grammar. Grammar number 2, imperatives. Imperatives. All right. The doctor is telling you what to do. Do this. Stand up. Sit down. Right? Imperatives. Take this medicine. Don't sleep in your car. Blah, blah, blah. Imperatives. Let's listen first to the imperatives, and then we will discuss them.
Page 82. Exercise 9. Grammar focus. Imperatives.
Get some rest.
Don't stay up late.
Drink lots of juice.
Don't drink soda.
Take one pill every evening.
Don't work too hard.
All right, so these are the imperatives like we talked about before in the pronunciation. So these ones are positive, affirmative. Get some rest. Drink lots of juice and take one pill every evening. All right. These ones are negative, and the negative is immediate. Don't stay, don't drink, don't work. All right. And if you want extra information, it looks like 143, I'm not sure. In the back of your book, there is an extra grammar plus if you are interested or want some more practice. When you're done, it says complete the sentences, use the correct forms of the words in the box. Use the correct forms of the words in the box. Yes. So here it says call they used to call not worry. Yani don't worry. A hot bath. Hot bath. Okay, let's hit here. Take a hot bath here. All right. So the rest of these go into this exercise. Please put that information there. I will check it in class or online, wherever I see you next. And we'll check those together. Here it says, write 2 pieces of advice for each problem. Write 2 pieces of advice for each problem. So each picture, we have some problem. And again, here, number 1 says, my feet hurt. My feet hurt. Yani, what advice do you have for her? What advice do you have for her? Yani, don't wear those shoes, for example. Or go barefoot. Yani, no shoes. Number 2, I have a sore wrist. I have a sore wrist. What advice can you give him? Number 3, my eyes are dry. My eyes are dry. Stop looking at the sun and use some eye drops, maybe. So you are going to put your advice. This is for you. Put your advice here and we will compare in class. Write your advice and we will compare in class. The last thing to do, of course, my lovelies, is the reading. All right? The reading exercise. What does your body do to keep you alive? Take the quiz. Take the quiz. So you should read this, complete the quiz, and answer the questions below. Do the reading, answer the quiz, and the questions below. Again, any new words, you want to mark them, you want to translate them from English to English, English to English. Do not write in Arabic, all right? And we will look at them all together in class or before online, all right? So once you have completed this reading, you are at the end of Unit 12B, which means that you're at the end of the first half of this level. Congratulations. Please review the vocabulary, and if you have any questions, please feel free to ask me. All right? I look forward to seeing you in class, either in the office or online. Until then, Assalamu alaikum wa rahmatullahi wa barakatuh.